Welcome back to the new norm with Lou Graham, brought to you by Midway Dental and Catapult Education. This will be segment 3 with Dr. Karson Carpenter. And I think, again, what's very, very interesting in the news this morning is that the outbreaks, or these peak outbreaks, initial peak outbreaks, are going to be happening all over the United States, really at different times. And the latest is that we'll have different peak outbreaks all the way potentially through mid-May. So where New York is going through theirs and Michigan is going through theirs, other states may end up going through their peak periods early May to mid-May. So this is all the ongoing challenges of how we're going to be dealing with the new norm and the virus. So let's get back with Dr. Carpenter. And Karson, okay, next question. You're talking with your patient. They're wearing a mask. They've washed their hands. They've done their pre-rinse. The room's disinfected. And they tell you, last night I started feeling a little yucky. I think I'm just not feeling great. And maybe they didn't have the fever that you've already tested for, but they just tell you that. Karson, what now? What do we do now with that patient who potentially could be becoming symptomatic? Walk me through this and the new guidelines.
I'd be glad to do that, Lou. And one thing that you've made a point of is very important. Yes, we've asked the patient, we've screened them pre-coming into the office.
Yep, right.
But now we need to ask again because things can change quickly, correct? So that patient's
correct.
laying back. You found out maybe they do have signs of respiratory infection. You're concerned they could be a COVID-19 patient. What would you do? Immediately put the mask on that patient. Send that patient home if they're not acutely sick. If they're acutely sick, you need to refer them to a medical facility. For example, they're having difficulty breathing. And that's why it's very important to identify a medical facility. If a dental treatment's urgently needed, and it's a possible COVID-19 patient, they need to be referred to an appropriate facility. That's not your office. You don't have a negative air pressure room. The patient may not be happy, but you can't treat that patient.
Okay, I'm with you. Okay, so let me get back to the mask dilemma. So let's say now you've got to take out a tooth. It's one of the emergency guidelines. You've got to drain an abscess, whatever. I kind of want to hear from you. When do we move from a facial shield and a level 2, level 3 mask to an N95 or a KN95 mask? What's the protocol for using one of the respirator masks?
Well, again, it is a tricky question, but here's the thing.
Okay.
First of all, even with an N95, I want everybody to understand this. Even with an N95 or KN95, I want them to understand that you can't treat in your dental office a known or suspected COVID-19 patient.
Right.
You can't.
Right.
Your facility's not designed for that. But when would you use an N95? That would be if you're going to, quote, generate an aerosol. Okay? So if you've got the patient back in the chair, you've determined that you need to do something that generates an aerosol, then you need to wear an N95. Well, I'll tell you, what generates an aerosol is any rotary handpiece. So obviously high speed or low speed. Secondly, would be the ultrasonic, which there's no reason to use that. I don't think we need to do ultrasonic scaling during this emergency period. But third, what about the air-water syringe? When you mix air and water together and blast that tooth, you can potentially create an aerosol. So I think we need to try to eliminate aerosol-generating procedures. When we do have an aerosol-generating procedure, we need to wear an N95.
So openly, when a patient comes in and they've got an abscess tooth or a pulpitis, and we have to go in and start a root canal, let's say, and open up that pulp, openly, that's an aerosol procedure. I would assume, Karson, we would be minimizing aerosols as far as cross-contamination. Obviously, if we're absolutely using a rubber dam in that situation, Again, just asking your thoughts on that, because we're going to need aerosol occasionally to see some of these patients.
Yes, we are. We are going to need aerosol occasionally. So the key things would be, one, having N95s. Again,
Yes.
it's important also to not generate aerosols when you don't have to. A rubber dam is a great
Right.
method of minimizing an aerosol. And certainly we're going to want to use very careful high volume evacuation. That's what OSHA considers, quote, local ventilation, where you can suction off that mist, that aerosol, before you have to rely on personal protective equipment to filter it.
Right. So also then let me ask you, products like Isolite and similar type products, will they, for the offices that may be doing a procedure and they can't get a rubber dam on a tooth or whatever, would those help minimize the aerosol contamination with high-speed surgical suction?
Absolutely, absolutely.
I don't know that. Yeah, okay.
That is what OSHA would consider an engineering control, any engineered device that can make the workplace safer. So to me, to have an Isolite going and to have a high volume, maybe in addition, when you're actually running the high speed, is a great idea. A great idea. That's going to minimize the aerosol.
So with offices today that are going to be seeing emergency patients, and when they have to create aerosols, I've got to be thinking, if you're not a rubber dam user, and I know a lot of people aren't, then you're going to have to invest in a system, like you said, an engineering system like Isolite and others. This is no endorsement of one particular product. But again, that would be part of ramping up your infection control, aerosol control procedures. And I would think that's something people have to be looking at right now for April and May and June. And this could go on into the summertime and far beyond. These instruments could become part of the new norm as standard in our practices. Your thoughts?
Oh, I think you're right. I think you're right. Because once we start using those, really realizing the dangers of aerosols, we're going to want to continue to do these things. Absolutely. Because you know what? There'll be another COVID-19 someday. And if not, we have our regular seasonal flu, cold, etc. This is going to make the workplace safer for sure.
Okay, so we've covered already a bunch. I got to get back to these masks. My concern with these N95s and KN95s masks, and I just ordered my KNs from Midway because I really want my N's kind of to be open with you. I want them in the hospitals, and I think the KNs, based on what I'm reading, will protect me for what I'm doing. But I think the number one thing for me in using one of these masks is how you fit it. And everything I'm reading is that it's all about creating this seal that really goes far and beyond, because if you don't create the seal, it's a huge problem. Can we talk about the seal, Karson?
I'd be glad to. I'd be glad to. And the one thing that we need to know is our, quote, surgical masks, the things that we've been wearing all along, the level 1, 2, and 3, they're really designed more to protect the patient from us than, to protect the patient from us rather than us from them. And the problem, the seal, exactly what you mentioned, where a true respirator has a very tight seal. That's the problem with the traditional mask. It doesn't have a tight seal around the face.
So in my last interview with Tracy, she went into an amazing detail about the fitting and the proper ways to do this. And I couldn't agree more, but there's a reality here. And the reality here is if they go to YouTube and they follow instructions how to really put on a respirator or tight mask, is that sufficient or is it just not sufficient? Like, I really understand where Tracy's coming from. I just think I'm just trying to be practical here. Your thoughts again?
Well, Lou, here's the thing. Having been involved with OSHA compliance for many years, I've always taught that, and this is when I'm teaching in industries outside of dentistry, if you use a respirator, first of all, number one, you have to have a written respiratory protection plan. And that involves 8 questions that are asked of the employee as well, standard questions. Number 2, you
Right.
have to have a medical evaluation of that employee. Number 3,
Right.
you have to have a fit test. And for this type of respirator, you could use what's called a qualitative fit test. But still, practically
Right.
speaking, how are we going to do that right now? If you take a look at 3M's website, you can't get a qualitative fit test for 2 to 3 months. Okay, let alone the respirators, which are hard to come by. Practically speaking,
Right.
it's a real problem for us in dentistry to do it the right way right now.
So I agree with you. And Tracy, in our interview, and that's a segment I encourage everybody to listen to, she went through exactly what you were talking about, a written plan, the 8 steps, medical evaluation, and openly, I'm seeing patients Wednesday, emergency patients. I don't have this stuff. And so as I get my masks in place and my facial shields and stuff like this, and I want to take care of people on the emergency basis, one of the pearls I heard from a doctor who's a colleague was that in the operating rooms and in certain, we'll say, triage areas, and they put on these masks, they spray a peppermint spray or a cinnamon spray, and if you can't smell it, there's a good likelihood you've created the seal that you need to. I know I'm catching you off guard on this question, but does that kind of make sense? I'm just trying to make sense of this. Yeah.
Well, what you're describing, Lou, is a qualitative
Yeah.
fit test. The only difference
Right.
is that to conduct a proper qualitative fit test, you actually have to have a full hood that goes over
Right.
the head.
Yes.
Then you spray
Right.
things like this peppermint spray or a banana oil
Yep.
in there.
Right.
And if you can't smell it at a certain level, the respirator is
Right.
deemed not fitting properly. Now, respirators have different sizes, okay? Maybe one respirator doesn't fit a very small staff member, a small female, like it might you. So what you're describing is not the full fit test. I suppose it's better than nothing. I guess
Right.
you'll have to make that decision.
Right. I mean, but I agree with you. If you're going to wear these masks, you've got to put them on properly with the strappings, with the seal, at least to maximize the opportunity of what we're trying to obtain with them.
Yes, you
Absolutely.
do. And while OSHA has relaxed the requirements, they've not relaxed the requirement for an initial fit test. They've eliminated temporarily the requirement during this emergency for an annual fit test. But still, the medical evaluation, they stay as required. The written respiratory protection plan is required.
Okay. And so let me ask you that. Where would they find that? Or is that something Midway could put on their site as far as just, again, jump-starting this? Everybody's so stressed today, including me. If we place those tests, or could you provide kind of some guidance on those tests so we can post them on the Midway Dental site? Would that be possible?
No, we'd be glad to do that. We'd be glad to do that. And that way our doctors can take a look and evaluate and make a decision on their own. I can tell you, Lou, if I'm walking into a room and I'm going to run a handpiece, yes, I'm going to want to wear an N95. I guess we have to make the decision if it should be just us in that operatory.
You mean versus the assistant?
Right, because ultimately we do have the responsibility to protect our employees.
Of course. I know, but I need high-speed surgical suction, even with a rubber dam, and and with a respirator mask, and she's wearing a respirator mask. I can't imagine doing two-handed dentistry and doing it in a quality way with that mask on and the facial shield. Oh my God.
Remember, Lou, in dental school when you suctioned with the high volume with your left hand? I heard you were pretty good at that.
Actually, under the table, I paid a dental assistant cash always to be my fourth hand. I'll just leave it at that. I had a lot of classmates who questioned me on that, but I always learned four-handed dentistry. Okay, so here's what I want to do. I'm going to wrap up this segment. And what I want to do in our fourth and final segment, Karson, when we do this, I want to talk about emergency dentistry, the definition of it, what people are doing, what people aren't, what should be doing, And that's going to be our next and final segment with you. So I'm going to dial you back in shortly, and I want to do our fourth segment. Thanks for being on this segment, Karson. So let me be clear. We want to hear from you. We want to hear your questions. So what we want you to do is we want you to go to education@midwaydental.com. Shoot us your questions. We'll go right to the experts. I know I'm not the expert, so let's go ask the experts what we should be doing as our next step next week, the week after, and thereafter. I look forward to hearing from you.